All right, thank you. I would like to call to order the Joint Boards of Health and Hospitals meeting on Thursday, April 15th from 8 to 9:30. So thank you all for attending, and I hope everyone is well and has had a good week. I'd like to start by requesting a motion to approve the Zoom video minutes from March 18th, 2021. May I have a motion, please?
Move approval.
Second.
Thank you. So approved. And we will get into our first agenda item, which is Dr. Eccles and our COVID-19 update.
Good morning, everyone. Overall, similar to what we're seeing across the region, there's been a slight uptick in COVID-19 cases. In the city of St. Louis, our average has gone from roughly 20 to 21 cases over a 7-day period to 32. So our case rate in the city of St. Louis right now is 10.3 per 100,000. Our percent positivity is also starting to creep up. It had been around between 4 and 5 for about a month and a half, and now it's up to 6. And so we're monitoring that really closely. Now, one of the things that we've seen in the city of St. Louis is that we're seeing more youth being infected with COVID-19. So they're accounting for more cases. The population that's still driving the majority of cases in the city of St. Louis are those individuals aged 20 to 39. But again, we are seeing an uptick in those who are less than the age of 19 and younger, in particular school age youth. And so based on anecdotal data we received from our disease investigators, we're having some similar challenges that we were having back in the fall of 2020, where we're having parents aren't enforcing the guidelines within the home. For example, they're not having their child quarantined for 14 days or isolate appropriately as instructed by the medical provider, as well as adhering to the city's social distancing and face covering requirements. And so we continue to educate parents and guardians about the importance of really adhering to the mitigation measures and the COVID-19 restrictions that we've put in place to further slow the spread of COVID. In particular, we're really worried about the younger population, particularly those who are younger than the age of 16, because at this time they're not eligible to receive any of the COVID-19 vaccine products that have been approved under the FDA's emergency use authorization. So not only are they not eligible to receive the vaccine, but there are also a significant percentage of them are still susceptible to getting infected with SARS-CoV-2. But according to our last report, just slightly over 1,200 individuals who are of school age youth in the city of St. Louis had actually tested positive for COVID-19. So that's, again, a significant percentage of youth in our jurisdiction that have not tested positive and remain susceptible to COVID-19 or SARS-CoV-2 infection. And so we are, again, working really closely with working really closely with our partners to get information out to parents as well as to schools. So we have a weekly meeting with the school systems in the city of St. Louis, which includes the St. Louis public schools, charter schools, independent schools, and the archdiocesan schools. And they've been working to get information out as well. And so we'll continue our communication efforts to make sure, again, the community at large is aware of the importance of adhering to the mitigation measures to protect families and our most vulnerable population. While talking with the representatives from the St. Louis Metropolitan Pandemic Task Force hospitals, they're also seeing an uptick in new COVID-19 related admissions. And so they're also keeping a close eye on that. And they're also looking really closely at the percent positivity amongst their symptomatic patients. One number that I was quoted from one of the clinics was about 28% of individuals who presented with symptoms were actually testing positive. And so that is really alarming and it indicates that there may be more virus being spread in our community than we're aware of. We know that sometimes the surveillance data can lag behind what's actually happening in real time. And so that's the percent positivity is an important indicator to follow, not only at the citywide level, but also at the health system level. So we'll be continue our efforts to work with the Pandemic Task Force hospitals and local public health agencies across the city of St. Louis. For our vaccine distribution, the City of St. Louis Department of Health continues its mass vaccination efforts. To date, we have held, I believe, 25 or over 20 mass vaccination events in the City of St. Louis, and we've administered over 30,000 COVID-19 doses. Primarily, we've been using the Pfizer and Moderna vaccine products. However, we did use the Johnson & Johnson product on March 25th and March 26th. At two mass vaccination events that were held at St. Louis Community College and Forest Park. During those events, we administered 6,600 doses of the Johnson & Johnson vaccine. To date, we have not received any reports from individuals regarding adverse reactions, but we continue to be mindful of that as well. Along those lines, with the recent news that has come out about the Johnson & Johnson vaccine, the state has paused under the FDA's instruction and CDC's instruction to the administration and distribution of the Johnson & Johnson vaccine. And so we were planning to use that particular product for some of our special events, but we are holding until we receive additional guidance from the state and the CDC. We do have additional projects that we are starting this week. One is for our homebound population. So the City of St. Louis Department of Health is partnering with the city's Fire and EMS Department, as well as Team Rubicon and the Department of Human Services, particularly the St. Louis Area Agency on Aging, to vaccinate, to provide COVID-19 vaccinations for individuals who are homebound in the city of St. Louis. Today, we'll be issuing a press release about this particular project. We had a soft launch on yesterday where we provided 12 individuals and their caregivers with their first dose of the Pfizer vaccine. So we'll be going back 3 weeks to administer their second dose. And so we're really excited about this project because it allows us to reach populations that aren't able to come to our mass vaccination events or even some of the other clinics that may be in their neighborhood. And so we're really grateful for the work that the Department of Human Services, the Fire EMS Department, and Team Rubicon are doing to help us lift this critical work. We also continue our efforts with corrections. We have several weeks ago, we started providing COVID-19 vaccine for the Justice Center, as well as the Medium Security Institute, for those individuals who are eligible and who wanted to receive the vaccine. So to date, I believe that total of 30 individuals who are fully vaccinated. Again, we can't make it mandatory for individuals to get the vaccine, but we do make it available for individuals who want it. And so 30 individuals are fully vaccinated, and that number will continue to increase. We have additional individuals who have received their first dose, and so we'll be providing their second dose over the upcoming weeks. In total, right now, there are an additional 160 individuals who desire to receive the vaccine, and so we're working with Commissioner Glass and the corrections medical provider, Horizon Health, to make sure that those the first and second dose are administered in a timely manner and according to the protocols established under the approved EUA guidelines.
Question, Fred. We're obviously quite alarmed at the continued propagation of the SARS-CoV in our community. Do we have a kind of a neighborhood coded map, even a street level map of the vaccine distribution? I'm interested in sites that have been missed, and I'm interested in what you sort of stated how you move forward. There's a concerted effort to address one high-risk population, but we need to know where the gaps are in vaccine uptake within some of our underserved areas.
All right, so that's something we're working on. So we'll be partnering with the state because some of the information, we only have the data for the health department. And so the state has the information for the hospital systems, federally qualified health centers, and other COVID-19 vaccinator sites, which include private and retail pharmacies in the city. So we don't have that data. So we'll be working with the state to get that data. We know that there has been some data challenges as it relates to the vaccination information. And so we're, again, working with the state to identify to get that information. But we've identified other populations, to your point, that still need opportunities and access to COVID-19 vaccine, and those include the immigrant population and non-English speaking populations. And so we've been partnering as well with Casa de Salud and STL Juntos, as well as one other organization, to reach out to the Hispanic Latinx community. We also reached out to Oasis International, who works really closely with some of the African immigrants. And so we are working with those organizations, and we'll be scheduling events tailored to those particular groups over the upcoming weeks to make sure they, again, have access to COVID-19 vaccine. But we have to be mindful of how complex that situation is, because there's the distrust of government, and then concerns, particularly if they're undocumented and living in the city of St. Louis. And so we will be working to make sure not only do we give them access to the vaccine, but we also want to make sure that they feel safe coming to the place where the vaccine will be offered to them. And so lots of complex issues that we're working through, but we do have grassroots organizations at the table who are trusted amongst those communities. And so we'll be working with them to hold additional vaccination events. We also continue to work with FEMA. So FEMA is doing really great work at the Dome. They administered over 2,000 doses, over 2,400 doses on yesterday, which is a record for them since they've been in the city of St. Louis. And part of that is due to the outreach work that they've started to do in partnership with the health department and other organizations to make sure as many people as possible are informed about the opportunity to receive the vaccine, but also that they know that they're removing barriers for individuals to receive the vaccine as well. At the beginning of the project, there was, it was registration only, or at least registration preferred, and then they weren't necessarily taking walk-ins. At least they didn't like to take walk-ins, but now walk-ins are welcome, and they're also waiving documentation if people don't have, so they don't want anyone to be turned away. But again, there's still levels of distrust as related to just being a government entity. And so we're going to be working with them, hopefully over the upcoming weeks, to do more of a grassroots level campaign to go out into the community, not only to inform them about the event that is taking place at the Dome, but we also want to make sure that we want to hear from individuals why, if there's any hesitancy about coming to the Dome, what are those reasons? Is it transportation? Is it because it's a government agency? Is it still issues about misinformation related to the vaccines that are available? So we're going to be working to not only inform the public, but also hear from the public and take that information back. And we'll be working with them to tweak their messaging to make sure that we specifically address the concerns that we hear from the community when we go out and canvass the areas.
Thanks.
Thank you, Dr. Eccles. I have a quick question. Have you been able to analyze and identify any correlations between vaccine distribution and zip codes or areas where you had case increases?
Not at this time. So that's something that we're looking at as well. So one of the things that we want to do is create a COVID-19 dashboard, particularly for vaccinations. And so we'll hope to have that in place over the upcoming months, but that's going to take some work in partnership with not only our epidemiology team, but the state and our IT division in the city of St. Louis.
Thank you. Do we have any more questions or comments about vaccine distribution? Dr. McBride?
Yeah, thanks. And thanks for all your hard work, Dr. Eccles and your staff. And, just when we think we can let up a little bit, we can't. So that's part of the message we are hearing. I think you answered in good part what I was thinking. And I did look up on the website at the state just now, and I had sort of the same question that Dr. Ross did about where the distribution of the vaccines were by zip code, but I saw that our St. Louis City is 23.8% first shot of the vaccine, and the county's 30, the state is 32%. So we're still lagging behind the state for whatever reason. So a lot of the comments you made about making sure the message goes out, and I know there are press people listening, so the message needs to go out that there are places to get the vaccine, and you spoke of a lot of ways that, I was also perplexed why we weren't just having walk-ins. And, we put in a lot of barriers to, you got to make an appointment, you got to go through a website. I had to do it myself. It was not easy. We should just make it possible for people to get in. So I'm really pleased that that's happening. And we got to get to the bottom of why that number is not rising faster. My question is, do you have a clue about why it's rising so much among younger folks? Do we know why? You were telling us that the rise in cases appears to be among, say, 20-year-olds or younger or whatever. Do you know what's going on there?
Also, recently there were some major events. So you had spring break, which spanned over a 2-week period. And then also, and that followed by Easter weekend, which is typically includes lots of fellowship, as we call it. And so, and I think with more people getting vaccinated, I think they're becoming more, potentially becoming more lax. Because I think there's still this perception that the vaccine is a panacea, and it's really not. And so we have to continue to remind people that even though you're fully vaccinated, you can still get infected with SARS-CoV-2 and spread it to others. And so if you're not adhering to those mitigation measures, you could potentially be spreading to others who have not yet been vaccinated, and that can be cause some major issues for not only the city, but for the region. And just one update. So we do have a map of vaccine distribution in the city, and I can share that with the board after this meeting. But it goes through March 30th.
Thank you, sir.
I see that Dr. Maddie has a question as well.
Yes, thank you so much for that update, and I apologize for the baby sounds you will hear in the background. I just wanted to ask, and I apologize if I missed this earlier, if there is any update on how many people in our city have received the Johnson & Johnson vaccine, and or are signed up for it in the future, and if we've already addressed plans to make sure they understand, where they can get Pfizer or Moderna, and any just response to the news this week and how that's impacted our city.
I don't know the total number of individuals who received the Johnson & Johnson vaccine. And there's a lot of different organizations that are doing outreach. And so the health department does not have access to all of that information. But I do know that the city of St. Louis Department of Health did issue or administer 6,600 doses during our over the course of 2 days during our mass vaccination events that were held at St. Louis Community College at Forest Park. But we can work with the state to see how many people in the city actually received the Johnson & Johnson vaccine. But that depends on the information being submitted to them in a timely manner as well. So, but we'll work.
Absolutely. I appreciate that. I think my comment to follow that would just be that, a lot of people understandably have concerns around what this news will mean for them if they have received it. I will put in the chat what I think is probably the most comprehensive and reliable document about what to expect about, potential clots, especially for women in that age group of 18 to 48, I beg your pardon, who all 6 of those women were. And just to get ahead of, possibly even updating our website to provide a link to more information for the public, because that's been probably, that's been all the questions that have come my way since the announcement around the pause.
And I think the other thing that we need to, we'll emphasize, we don't want to underplay or downplay the importance of the news that's come out about the Johnson & Johnson vaccine, but it's really important for people to know that this complication is extremely rare. So less than 1 in a million, I believe over 7 million doses of Johnson & Johnson vaccine have been administered. And so for 6 individuals to develop this complication is really speaks to the fact that it's extremely rare. And the other thing that it really highlights is that the reporting of complications related to vaccines like that chain of communication actually works. And so oftentimes we think if we're submitting things to CDC, whether it's through the vSafe application or through other applications that record complications or side effects associated with vaccination, that it just goes into this black hole. But this shows that actually works, and people are actually paying attention to the information that is being collected related to the COVID-19 vaccine. So we really need the community to know that when they receive the vaccine, if they have any side effects, whether it's minor or major, that they be reported through the applications such as vSafe and communicated to their medical provider, because their medical providers can submit that on behalf of their patients as well.
Absolutely. And the last thing I would add is that I couldn't agree with you more, Dr. Eccles, about the importance about people understanding not only how rare this is, but how this is the exact process we have been asking for and advocating for, especially in communities of color. Transparency is the first step to earning trust in these communities. And so I think it's important for us to be leaders in making people understand that the way that this was done was actually in line with what we've been looking for. And that this pause is primarily to give clinicians and healthcare systems an opportunity to understand how to give the best informed consent around the Johnson & Johnson vaccine moving forward, and also how to respond if anyone were to come with such a rare complication. So I couldn't agree with you more. Thank you.
Thank you. Do we have any other questions or comments? And thank you for all the information that's been provided thus far. Any other questions or comments before we move on to the next agenda item?
I'll just give one additional shout out to all of our partners who have helped us with these mass vaccination events. This has been a very heavy lift. And our partnership with St. Louis University School of Nursing, Western University School of Nursing, other academic partners, Washington University School of Medicine, independent medical providers, as well as our Medical Reserve Corps, and of course the health department staff. Everyone has done an amazing job of helping us pull off these vaccination events. And I can't forget the fire and EMS departments who have provided oversight for our observation areas. Everyone has done an amazing job. So we're grateful for those partnerships and the work that they've helped us do thus far.
Wonderful, thank you. So we will move to our next agenda item, which is a special presentation from our St. Louis Science Center.
Great. And I'll open up for them. So one of the things that we wanted to address using our COVID-19 dollars was vaccine hesitancy, not just vaccine hesitancy related to the COVID-19 vaccines, but more general. So a lot of people don't understand the importance of vaccines and the role that they play in protecting the public's health. And so we've partnered with the St. Louis Science Center to do this. This is right in their wheelhouse. They have a great history and reputation of providing accurate information, not only to individuals, but to families and more general populations. And so we have partnered with them for this. And so I believe, I see Ruth and Andrea are on. So we're glad that they are able to join us this morning.
Hello. Hi. Hello, everyone. Thanks for having us for a little bit here. I'm Ruth. My current title is Manager of STEM Events. So I've been in the Science Center for a little while, and I have a great love for just life science and education. Been here over 25 years now, and it's been great. It's been great to partner with the Department of Health, and I see that Amanda's here, Harold, and I think Kim's here too. and I think we're missing Suzanne, but it's been fantastic. But I'm going to hand it over first to Andrea Durham, who's also with us. She is our Chief Officer for Science and Education. She's sort of brand new with us, and we're excited to have her here. And she's been great to provide her just leadership and guidance. And I'm going to share screen and let her kind of do her thing.
Good morning, everybody. We are thrilled with this partnership. I may be new. I'm pretty new to the St. Louis Science Center, but I am not new to the museum field. I've been in the museum field for 20-something years. And I would just echo what Dr. Eccles said so well, that we are primarily a trusted source for science learning, lifelong learning. All science museums and science centers play an important role in our society. People look to us as science communication providers. places where they can do lifelong learning around not just science, of course, all the STEM fields. So we're thrilled. This, as he said, this is right in our wheelhouse. People look to us and to learn the facts about science in a way, and science communication being our specialty is really how we communicate. We are experts at how we communicate complicated science to the public. And the public acknowledges that both by coming to the Science Center to learn, but also going to our website for trusted source of information. So I just wanted to briefly touch on our multi-pronged approach, and then Ruth is going to dive a little deeper into our the specifics of our approach. We're doing internal and external communication. Internally, we've done some fairly extensive staff training so that any colleague feels prepared at the Science Center. Any member of the public who comes in and asks our staff a question about the vaccines or about COVID is prepared to answer those questions in a very understandable way. So that's our one prong of our approach. Another prong is that we're doing stage presentations. I invite you to look at our website. Some of those presentations are on our website, and they do a great job of communicating about COVID itself and the importance of mask wearing and the science behind that. And we have additional kind of up-to-date COVID and vaccine information on our website. And we are pleased to say that today we have opened 2 new exhibitions in the tunnel between the 5050 Oakland building and the planetarium. Because science centers are, it's not just us, science centers across North America are science communication specialists, and people have been developing exhibitions and providing them as open source so that all museums can avail themselves of the research and the work that's been done to develop exhibits. Our team vetted, several of these exhibits have been made available. Our team did a great job of vetting them and selected 2 of them. These are teeny pictures, but if you can come to the Science Center and see them yourselves, that would be fantastic. One has been developed by the Smithsonian Institution. It's called Outbreak, and it really talks more generally about pandemics. It's a wonderful exhibit that I've seen actually in the Smithsonian. We're bringing it to our community. And then the second one, of course, a terrific science communication organization that we all know and love, NASA. They also did an exhibition. They're fairly small scale exhibitions, but they're really nicely done. And as I said, we did a great job of selecting them. And I want to thank the team for all their hard work on this project. And I'm going to turn it over to Ruth.
Okay. Can you all still hear me? I'm
Yep.
now that I'm screen sharing, I can't see myself or any of you. So I'm just going to scroll through the documents that I have. And if you have questions, I have no way of knowing that you have questions. So I apologize.
Ruth, I can monitor the chat and give
you. Thank you. That would be great. So we are so happy again to be working with Dr. Eccles and his team at the Department of Health. I'm just going to show you kind of where we're going with what we have. As Andrea mentioned, we do have video or shows and things that we're doing at the Science Center. So some of that we are sharing with you. We actually are going to, we have a current Germ Busters presentation at our energy stage, but we're creating a whole new vaccine show. We think we're going to call it Going Viral because we love that title. We don't know yet, but we actually are going to videotape that or record that and make that available to the Department of Health team. And so our, I guess, deliverables or package that we're working on in partnership with you all has a couple of elements. Because your primary communication mode is through emails and a website and social media, we understand that probably what we can help you with is just providing these electronic files. And that will be in the form of both videos and infographics. And so I'm going to just show you the infographic part of it here. Let me just scroll down. And so this is what we call an inspiration mood board. This sort of gives our design and creative services department the flavor of what they think they're going to create. And so what they were trying to do to give us what they call more bang for your buck is go with really bold colors and patterns. We really need something that is going to catch people's eye. There's a lot of information out there, obviously, but can we make it so that when in the process of scrolling through so many things, is there something that will catch you? And so colors, patterns, let's make it sort of easy and inviting and engaging just visually first. You pull people in and you say, hey, I've got something, this is cool. And then here's where we go from there. Our department has been really good to just say, okay, we found colors and we found a font that's going to be easy for people to read. So they create all this lovely mood board elements for us. And then let's move over here. So part of our infographics will be the what I call the posters. They're going to be things that are printable, and we're going to make them 8.5 by 11 in size, so that as you're sending things to both doctors' offices and schools, they can be easily printed. We'll keep them one-sided so that they can be shared and printed out. And here you just see an example of just colors and layout. It's simple, it's easy. I will point out the let's see, best mask basics. That is the amount of text we like. We don't want a whole lot. So part of the research that we did and understanding how to communicate vaccine information with the public, over and over again, they said, you know what? Keep it short. Keep it in short, digestible bits. Keep it simple, because there's just so much information out there and people are just kind of bombarded with it. And you get that sort of fatigue, right? So keep it fun, keep it short, keep it easy. And then you'll see, like at vaccine types, that's a lot of text. So we are in the process of working with the Department of Health communication team to just edit, cut it down, because people are just not going to be attracted. There's so much text, they may just ignore that. So anyway, that's part of our work. So we've got not only the information, but we've left space at the bottom for more information. We've got space for a QR code, which is a place where people can, again, go to more information. The object of these things that we're creating is to invite people in, give them a tidbit, and say, hey, you can understand this. It's not scary. You can understand mRNA, DNA. We'll take it down for you. And then for more information, go here. That could be a QR code. That could be a link to a website. That could even be the Department of Health logo. But we've got spaces where you can put that in. So here's what's really exciting. We have kind of gone to this mode of, again, keeping things short, keeping things sweet. So we're calling these sort of like quick facts. And we're giving you sort of a format and tools where you can actually create content. But we've got these headers and we've got these things where you can plug in, like in an email, you can have these different categories. So here's to your health, vaccine vocab, and just did you know? Here's a cool fact. So the example here, did you know masks with ventilators or valves are not recommended? One sentence, really quick, really easy. We learned from our research with the public that icons work really, really well to communicate information quickly. So we've got icons that you can use. And again, bright colors and patterns to say, here's something. If you see nothing else, here's your quick fact of the day. So it's sort of like those calendars where you rip off something every day, where it's a quote of the day, a comic of the day, a vocabulary of the day. So it's almost like if you're doing regular, I guess, emails and communications with schools, doctors, or whatever, every day is like, oh, what's the new thing for today? What is it now? So it's a fact today about vaccines, all about vaccines. Or the actual content areas are going to include immunity and vaccines and preventative measures and myths and misconceptions. So the beautiful thing about this is we're going to provide you with a set of these quick facts, But we're also going to provide the template, because long after, you know, whatever is going on now with COVID-19, there's information that's changing all the time. It's being updated all the time. So we want the team to be able to say, hey, we've got new information, and we want to just put this out there so you can fill in the details yourself. It's going to be so you can actually provide a illustration or a photo here if you need. You can put your logo here. There's some flexibility, but it's a template. So you can, again, keep putting information out there. And we're going to give you a set so you can establish that branding, but then people will learn to expect that, whether it's social media, email, or your website. They can look for that and go, oh, what's the information for today? And it's just an easy way to, again, engage and invite people to just learn that information very quickly, very easily. Okay, let me stop sharing. I'm sorry, it sort of throws me off when I can't see your faces. But that in a nutshell is the infographics. I will tell you that in the videos are also the same format. So quick videos, 15 to 30 seconds. The things that cannot fit on a tiny little card or a tiny little fact in one sentence, we are going to do a set of videos where people are just saying, hey, did you know this? And hey, this is what mRNA means. And so I know there are people here, I recognize some names who've signed up to be part of our video crew, our talent. Really excited to have you all participating in that. Thanks for volunteering. I'll send you your scripts soon. But then you'll also have these quick videos that can be inserted in your communications and sent out. And we're just really excited to be able to participate with you. And thanks so much. I do want to recognize Christina Carlson from our team. She's here as well. She is our manager of adult programs, and she's part of our science team, and she's been the project manager for this whole initiative on our side, and we appreciate that. And I do also want to recognize Elisa Israel. She is the director of research and evaluation. Her team did a lot just to understand public perception and the hesitancy and all that sort of thing. Where are the people coming from? And I'm going to let Elisa talk about the research that she found. And we'll kind of go from there, if that's okay.
Thank you, Ruth. So what I want to do is I'm going to share my screen. I just have a few little slides to talk through a bit about our process in, as Ruth said, just gathering some data from our audience to help inform the team as they develop all the things that Ruth just shared about. So when we begin an exhibit or a program development process, we like to do what's called front-end evaluation, where we collect feedback from our audience about the topic at hand so that we can better understand where they are. This also includes, as it did in the case of this project, doing a literature review. So when we started this project late last summer, early fall, we began with a literature review of what was already out there at the time around topics around vaccine communication in general, the COVID-19 vaccine in particular, vaccine hesitancy. All of that sort of informed our direction for collecting data. And this was a very quick turnaround project, so it was pretty small scale. But we were particularly interested in understanding what are the questions that our audience have about vaccines in general and the COVID-19 vaccine in particular. So between late November and the end of January, so before the vaccine was really available and just when it was starting to become available was when this data was collected, we did sort of two things. We had a survey that was available both on our website and on site at the Science Center through a QR code so that people could do it on their phone to just sort of invite people to share their questions around vaccines. And then we were also doing some prototyping of an early concept related to some of those infographics that Ruth shared. And we incorporated into those interviews the same question about what questions people have. So we saw, sorry about that. So we saw several different categories of questions emerge from this data. Probably none of them are terribly surprising given what we know about vaccines in general and what has come out since January. But they fall into these categories. Firstly, just sort of vaccines in general. These ranged from very broad questions about how vaccines work to much more specific questions around vaccine efficacy and safety and things like that that were more specific. So just really understanding all those different types of vaccines, how they compare to other vaccines out there. And then for COVID-19 in particular, the vaccine questions around that tended to be very focused on personal feelings about things, personal impact. What are the side effects? Can I get the vaccine if I'm pregnant? Can I, how will it affect me if I've had an allergic reaction? So very specific kinds of questions related to the COVID-19 vaccine. And then also just trying to understand the COVID-19 vaccine in context with other vaccines that people may be familiar with from the past. You know, they may have had a tetanus shot, for example. So understanding how those different vaccines work. There were also questions about masks, particularly the question that we know has come up a lot since the vaccine distribution has really taken off, which is how long do we have to keep wearing them? So that's clearly something that we need to keep reiterating the importance of continuing to wear masks. And then the last category that came up in just a small number of instances had to do with some of those misconceptions. And I will note that on the survey, we also invited people to tell us how they felt, how knowledgeable they felt they were about vaccines. And the folks who commented on misconceptions, perhaps not surprisingly, also rated themselves as fairly knowledgeable about vaccines. So we have some hills to climb there. But these were misconceptions that we've seen in other places about vaccines causing autism, about misunderstanding how the trials function, and not understanding that double-blind testing is used in trials. So we know there are some of those misconceptions out there. So the recommendations that we then took to the team that they have used to develop all these products that are in the works now really had to do about dealing with talking on the basics, just covering the core science behind the vaccines, how they're developed, how they work, helping to build that confidence by building that understanding. Also needing to be very clear and transparent in talking about side effects, in talking about long-term effects, how long will the vaccines last, all those questions that we've been hearing about regularly in the media as well, and help build the trust and willingness to sort of break down that hesitancy. We want to also address these misconceptions, but we want to make sure we're not reinforcing the misconceptions. So one of the things that we saw in the research is we don't want to restate the misconception very directly, because that can actually lend credence to it. So we want to address the misconception by providing the correct information, but not emphasizing the misconception itself. We want to focus on the personal aspect, the you, so that it's very, so people feel very connected to the work and see themselves and the people they care about it in what they're reading, so that they can take action. We want to make sure that whenever we're depicting any people in the products that we are creating, we want to make sure we are showing diversity in terms of ethnic background, in terms of where they come from, and age and gender and all that sort of thing. We want to make sure that we try some different formats. We've described several of the things that we're working on. We're also thinking, we're thinking about videos, we're thinking about infographics, maybe even comics, just different approaches to appeal to different people. And we also want to make sure that every product, and you saw this in Ruth's infographic mock-up, that every product has a way to sign up to either get more information, to sign up to get a vaccine, to just take action, that they don't have to take further steps beyond looking at that product that they're looking at, that opportunity to take action is right there. So that's just sort of a quick overview of what we've done in terms of the background research. And thank you very much. Let me stop sharing my screen now.
Wonderful. Thank you for sharing all the work that you're doing at the Science Center. Does anybody have any comments or questions?
I did want to add, because it was recommended that we do have other languages represented, which is not something we would normally do here at the Science Center. We are going to have the videos, some of the videos actually recorded in Spanish, Bosnian, and Vietnamese. So we're really excited to be able to include that component in what we're doing. So we appreciate that recommendation, and it's going to happen. So yay.
Wonderful. Thank you. Thank you very much for spending time with us this morning. We are going to move to our next agenda item, which is the Health Department and City of St. Louis partnership with corrections. And I believe we have Commissioner Dale Glass on the call on our Zoom.
Thank you and good morning, everyone. I'll be brief. I think that Dr. Echols highlighted some of the partnerships related to both my medical staff and the Division of Corrections. I'll give you kind of our perspective of those partnerships. In the middle of March, I met with my medical staff and custody staff to talk about information I had been hearing on the West Coast about the flu. Every October and also in October of 2019, we have a flu protocol where we're wiping down doorknobs and services in common areas to prevent the flu. We heard some conversation about the coronavirus, but I also became concerned about what was happening on the West Coast as it related to flu, and I wanted to increase that protocol. So we met and we talked about the issues, and we talked about how some of the protocols we heard about cleaning and wiping down surfaces also applied to coronavirus. And so, although we did not say anything to the detainees about coronavirus, we met and talked to them about increasing our efforts to clean up as it related to the flu. And then we determined that, well, let's go ahead and try to develop some planning around COVID-19 now until we get more information. And I learned that our medical staff had already started taking temperatures as early as February the 3rd for new arrestees. So we increased that for both arrestees and our staff coming in the doors. We developed our protocol and then sent that to Dr. Echols for review, comments, and what we could do related to that issue. And that partnership continued as we learned more, updates happened. We contact Dr. Echols and Corizon, my medical provider, myself and Dr. Echols stayed in constant contact, talked about some of the issues that were different in corrections than in the community and how do we accommodate that. We didn't get our first case of coronavirus in the jail until I think June or July. But we contacted the doctor again, talked about that issue and concerns for spread. And the one thing that we were able to indicate is that we can actually help with the tracing as it related to people working in the jail or living in the jail with our video. So we could actually look and see who had contact with a known positive. And Dr. Echols gave us a definition of what constituted close contact. We went through video of the individuals. If we saw that there was either detainees or staff, we gave that information to Dr. Echols for the continued process of contact tracing. The doctor did also mention that we were able to vaccinate some of our high-risk detainees. Initially, I believe the state had indicated that the prisoners would fall in a later phase of vaccinations. And I presented to Dr. Echols that in the jail, it's a little different than prisons. We have people who haven't been convicted of anything. And the only reason that's relevant is because they could go back home anytime. And so we suggested that they should be treated the same as the community in terms of high risk. And Dr. Eccles was able to get that approved for us. And we identified 65 people, 30 actually agreed. And since then, more are agreeing. And we're able to get them the vaccinations. And as Dr. Eccles indicated, at this point, we have another 160 general population that also would like to be vaccinated. And we're hoping that's going to happen in the next few days. So every time there is an update or a change or something we need to consider, we, the three of us have conversation around that issue. The most recent change we did was returning to visits. And there was a request from the community as well as the detainees to be able to visit their families again, because it'd been about a year. And so we partnershiped again with Dr. Eccles, came, took him into the facility, showed him the operation, and he was able to make recommendations regarding that issue. And now people are starting to visit their families again. The other thing that is a little more precarious is we had a large group of volunteers that come in and offer programming, religious programming, medical program, mental health programming, drug treatment, things like that. And so we looked at that issue as well and tried to determine how can we return to a limited degree of that and still be social distance and recognize all the requirements. The one program, we're starting to hear back from people that were our volunteers and are fully vaccinated. And the one program that probably is leading the way is this is the season for Ramadan. And so the Ramadan class is continued by recording, and detainees could just pick up the phone and hit a certain number and they could listen to those religious services. And now that we're in the Ramadan season, we are trying to do the same tenets, allow them to practice their tenets and still say socially distanced. And yesterday we actually had one of those volunteers come in and kind of give direction and guidance so that the detainees could exercise their religious rights. And so it's those kind of changes, adaptions, taking in consideration what special issues corrections presents. And with my medical staff and Dr. Eccles, I think we've been very successful. We've had, I think the last time I checked, I haven't seen an update for March yet, but the last time I checked, throughout the whole season, we had approximately 106, 110 people that came positive. About 5 of those had muscle aches and temperatures. Everybody else was asymptomatic. No one's gone to the hospital. Today we're at 0. And so we've been pleased with the partnership and appreciate being able to work that closely. Thanks. That's what I have.
Thanks, Commissioner Glass. I just wanted to make sure that, so we often don't talk about some of our partnerships, but the health department has partnered with a lot of different agencies over the course of the pandemic. And we were grateful to have open lines of communication, not only with corrections, but other city government agencies. And the outcomes have been very fruitful, being able to protect the health of staff and special populations under the City of St. Louis's government's care. So thank you, Commissioner Glass, for your partnership.
Thank you very much, Commissioner Glass, for the report and for your partnership with the health department and for keeping your clients and those that you serve safe. Much appreciated. Now we will have. Does anybody have any questions about our the health department's relationship with corrections? Okay.
If I could.
Yes.
Yeah, thank you, Commissioner Glass. And for your report and for working with Dr. Eccles. As all of you probably know, the risk of an outbreak in prisons or jails is intense, and across the country that's really taken off, even in Missouri. So anytime we see, those numbers sound reasonably good. And I just so you know, I serve on the Justice Services Board for the county. And so we've been getting regular reports about what's going on in the county jail, and those numbers are extraordinarily low. In fact, the infection rate in the jail is lower than the region. So I kind of constantly call it out as a success story. And it sounds, first of all, the numbers you're citing, I don't know what the total population of the jail is. You said 100 cases over time.
Yes, we have a daily average of about 800 to 900, similar to the county. In fact, we have a partnership with the county. We call it Metro Jails. There's about 7 or 8 jails that talk around this issue and others.
Okay, great. Yeah, I mean, people need to put all this in context because people are living together in very close proximity, and you have high risk populations and et cetera. So, the one question I have that I don't think you really addressed, and I think has come up in the county as well, is some of the risk of spread has come from the officers and the corrections officials, and there's constant testing that's done of people as they come in the door after they get arrested, and also the officers, and then there's quarantining going on. Can you speak to that?
Yes, and also, if I may, when I say the average daily population is 800, over a span of a year, more than maybe a couple thousand go through the jail. So
yeah, okay.
It's relative to that, number of 100. So, I think our approach is a little bit different, or what the city does in terms of testing and vaccinating. It's not mandatory, but we do testing when they arrive. And then we do testing upon request, or if we see a positive, then we do the tracing and we spread that out as needed for testing. And if they don't want to test, we quarantine to make sure they're not ill and those kinds of things. I don't know if I answered all your question.
Do you know if do you also test your officers and corrections officials?
We don't require them to be tested. We have several that have been tested, and when they are positive, we are made aware, and we use the video the same as we do with the detainees to determine did they have close contact with detainees and or staff, and then we react to that issue.
Okay, thank you.
May I add just one other thing about jails, generally speaking? I think that a big issue early on when CDC talked about quarantining and separating people before you introduce them to your general population, a lot of jails struggle with that because they don't have the space to quarantine.
Absolutely.
And we were fortunate, but at times, depending on how the population increases or decreases, it becomes difficult to satisfy that condition. But I do believe that's been a very beneficial element to be able to have space to actually quarantine prior to introducing them to the general population.
Thank you.
Thank you very much, Commissioner Glass. Any last comments or questions? All right, thank you again. We're going to move to a brief presentation by Neha Sastry on substance abuse disorders in the city of St. Louis.
Good morning, everybody. My apologies, I'm just trying to this up. Okay, so this will be a kind of brief overview of substance use disorder trends in the city of St. Louis comparing 2020 to prior years, because we were anticipating an increase in substance use given the social isolation and limited access to resources that people were using, such as our community partners. If you take a look at the city's trends, they are much higher than that of Missouri and the United States as a whole. These are age-adjusted rates. That spike you see in 2016 was largely driven due to fentanyl-based overdoses, but we haven't seen a spike like that in the following years. 2020's statistics from the state of Missouri and the US have not come in yet, so it's difficult to compare directly, but if you look at Missouri's numbers, you can see that they are also starting to increase, similar to the city of St. Louis on the whole. When we look at substance use, we wanted to look at specific drug classes and by substance type. As you can see on the figure to your left, opioids largely drive the increase that we're seeing in substance use. But if you look a little closer to the figure on your right, you'll see that while fentanyl has increased dramatically over the last 6 years, cocaine and methamphetamines are also two substances that are increasing as well, while heroin has decreased over the last 6 years on the whole. We know that there are specific substances that make up the majority of overdoses, and the majority of these fatalities that we see due to substance use are attributable to polysubstance use. So only 43% of the total number of fatal overdoses, specifically in 2020, were attributable to a singular substance, and only about 46% of fentanyl-based overdoses solely involved fentanyl. So while fentanyl is definitely a growing concern, polysubstance use on the whole is also a large concern, as they make up the majority of our overdose fatalities. When we look at demographic distributions of substance use, African-American men and women make up the majority of our overdoses. But when we compare changes in trends over time, the largest percent increase in overdose fatalities since 2014 has been among African-American women, followed by African-American men. And this trend persists when we look at specifically the difference between 2019 and 2020. Meanwhile, white women are the only demographic group that's experienced a decrease from 2019 to 2020 in terms of overdose fatalities, and have had the least percent increase going from 2014 to 2020 on the whole. With COVID-19, we did anticipate that there would be an increase in substance use disorder and the subsequent mortality and morbidity. The figure to your left compares 2019 to 2020, and as you can see, there were more overdose fatalities occurring in March to July, and this was definitely during our peaks of the pandemic on the whole, when people were instructed to stay inside, stay indoors, stay safe, and also businesses had to shut down briefly due to the pandemic on the whole. And that's reflected in the changes that the increase in overdoses that we've seen in the first and second quarter of the year, as demonstrated on the figure to your right, where there was 118 overdoses during the first quarter of the year of 2020, which was much higher than seen in prior years. And the largest difference is noted in quarter 2, 2020, where there were 141 overdoses in 2020, but only 76 in comparison to 2019. So these are things that the Substance Use Steering Committee has kept in mind and examined as we've gone through the year. Also keeping in mind to identify any low-hanging fruit that we can create interventions for. Geographic distribution continues to indicate that substance overdose counts are predominantly located in the southern part of the south side of the city. When we calculate it by rate to control for population density, in 2019, overdoses are still most common among South City when we look at it by zip code region, as noted on the third figure from the left-hand side. But when we look at 2020 and we're still controlling for population density, that has shifted to where there were more overdoses occurring on the north side of city as opposed to the south. So these were geographic distributions that we're keeping in mind as the city moves forward with Narcan dissemination and naloxone resource dissemination as well. Another data source that we use is EMS data, because their data helps us quantify the number of non-fatal overdoses. There were 30% more non-fatal overdose incidences that EMS responded to in 2020 compared to 2019. Narcan was used in about 80% of them. The following most common substance used is Zofran, and is used as an antiemetic. But Narcan is being used in the majority of these non-fatal overdose incidences that are most attributable to heroin, which I believe to be a misclassification on the side of the people who are responding to these incidences. Because when we look at the ME's numbers on the whole, we note that there has been a substantial decrease in heroin-based overdoses from 2014 onward. As mentioned earlier, the most common substance that has been reported is heroin. When we look at the Narcan use of EMS non-fatal overdose incidences by demographics, we see that African-American men and women make up the majority of these incidences. Comparing 2019 to 2020, African-American men have been the driving force of the increase in non-fatal overdose incidences going from 2019 to 2020, with a near 9% increase between the 2 years. So as we move forward, at-risk populations continue to be African-American men and women. Overdose incidences have increased by 18% when we look at the first quarter compared to the second quarter, when we look at the first quarter of 2020 compared to the same time frame of 2019. In 2020 on the whole, the city of St. Louis had 36% more overdoses compared to 2019. COVID has really illustrated our need to have more open conversations about substance use and mental health on the whole, as well as employing other techniques to help people who are looking for treatment and resources during this time while we're instructed to stay at home. For this reason, we're also going to be working on a mental health indicator report that will be disseminated within the next month. But looking at these numbers and then factoring those into our interventions is really crucial as we continue to move forward through our new normal. I believe that's all I have.
Thank you for that presentation. You see that Dr. McBride has called it sobering in the chat, and I would agree with that. Yes, thank you for that. And I see a question in the chat from Emmanuel. Kind of is the high risk among African American women self-imposed or societal imposed?
So I think that would go towards qualitative data analysis that we haven't really gone to yet. I think that that's information that our community partners might be better aware of, because they actually engage with our communities. They through the other partnerships that we work with, such as MoHope. So they might have more information in terms of exactly what this high risk is attributable to.
If there's time, Rhonda, if I could ask a question.
Sure. I'd just like to say, I mean, historically, in terms of self versus is societal imposed, I mean, health equity issues, this just falls in line with other health equity issues and health issues that affect the African American population, which are rooted in structural segregation and racism. And I don't see this as any different than many of the other issues that plague the African American community. And there is literature out there to this effect. So in terms of self or societal, we know at a minimum in St. Louis,
absolutely
many structural and societal issues that cause a plethora of inequities, and this being one of them. So yes, Dr. McBride.
Yeah, I would echo that. And, what all those numbers, as I said, they're sobering. A great presentation again, Neha. Thank you. We know that, and I was thinking the same thing as this was being presented. It's being driven by poverty, racism, and I was wondering also about distribution. These drugs are not coming from nowhere. So it's I know you can't answer that question, Neha, but it's a question about where folks are getting these drugs. And but also, I really appreciate this presentation, because as people know, I had asked a question several times ago about, in COVID, what's the sort of mental health, behavioral health effects of COVID? And this is one example of what's happened. You showed while the shutdown was happening, substance use went up. So that's important to point out. A question I'd have, you mentioned that there were, in the deaths that happened, there were 43%, if I remember the number you cited, of cases there were multiple substances identified. Can you sort of point out which multiple substances were identified most often? Did Neha freeze? We lost Neha. I think we lost her.
While she's coming on, I think it's important, certainly in the spirit of academic collaborations, to connect the questions that were raised with the research that's conducted by the WashU Social Policy Institute. Tim knows it well, led by Mikhail Grenston Weiss. I think we will connect her with this report, so that we can better understand the question about the frustration, the angst within the African American community related to all the social factors that Rhonda alluded to, and some data that we're doing in collaboration, looking at the adverse response, the psychosocial responses to COVID. So there is, you're back. So there is data in the WashU.
I'm so sorry.
So I was saying there is data that's being collected in the WashU Social Policy Institute that could help answer some of the questions that were raised. And the person that we'll connect you to is Mikhail Grenston Weiss. Is that her last name, Tim?
Yeah, Mikhail Grenston Weiss. Yeah, and we can, they've been putting out reports from a survey, and if you want us to get them to present or at least get the data to the group, we can do that. I agree with that, Ross. Well, Dr. Ross, sorry.
All right, thank you again for that presentation, and I look forward to hearing more about future research, through the qualitative research and the collaborations with WashU. We are going to move on to our next agenda item. So under new business, we will have some introductions of the new Department of Health staff. However, I'm just going to make note that we were going to have a discussion on accreditation by Craig Smith. We are going to table that to May because it deserves a good amount of time. The accreditation reaccreditation is coming up soon, and Craig and I discussed some of the work that they're doing, and we want to give that a good amount of time. And so we are going to table that so that we can have a robust and thorough discussion of accreditation, and to figure out how the board and other stakeholders can help the health department and also understand what the health department is doing to move forward with accreditation and quality and process improvement type of initiatives. So we will go to the introduction of new health department staff, and then for some brief committee reports. So Dr. Eccles.
So just to be really brief, so today we have one of the new staff that are on. I'm not sure if he was presented during the last meeting, but one of the areas that we needed additional support capacity was epidemiology. So we have epidemiologists, but not an official epidemiology bureau. And so now we were able to, due to advocacy, we were able to create an epidemiology bureau for the health department. And to lead this bureau, we brought on Dr. Dominic Moshe, who has a wealth of experience. He's done work in other countries as well as with the Harvard School of Public Health. And so I believe he's on, so he can turn on his camera and speak a little bit about his experience and what he brings to the health department.
Yeah, thank you, Dr. Eko. I'm Dr. Dominic Moshe. I'm happy I was introduced in the last meeting, but in brief, I can say that I've quite experience working in Africa, in Europe, as well as in Boston, in the area of public health, as well as clinical research. So I'm here in the Department of Health AP Bureau to support all the research work, as well as performance evaluation of the program. So I'm happy to be with you and looking forward for your collaboration and support. Thank you.
Thank you, and welcome. We are happy and glad to have you at the City Health Department. Any other new staff or employees, Dr. Eccles?
We have new staff in the Communicable Disease Bureau, but I don't think they're on. They have other duties today. So, but that will be an opportunity to introduce them formally to the board so that they're aware of who they are.
Wonderful, thank you, and we look forward to meeting them. So we will move on. We have 10 minutes left. We'll move on to committee reports. So the Governance and Nominating Committee, I know that Linda and Paul are on it, and we had a discussion about coming up with kind of a formalized strategy for governance committee reports. And we'll talk about that at the next board retreat, which is going to be May 5th. Any other additional information to add to that?
I don't think we're on. We're just preparing for the retreat and some of the larger questions we have regarding the charter and some of the other sort of bigger issues on our plate for them. So thanks.
Wonderful, thank you. Academic Public Health and Collaborations Committee.
Very quickly, we're looking forward to the contract between St. Louis University and Janine Irigi for us to do some of the background work that we need to do as part of that. And quickly, I just want to note how, this meeting is just chock full of so many things in terms of quality improvement and figuring out how to really document this. There is so much work that is going on here in the community and in the Department of Health. We need to really document this. What's going on with the Science Center, my God, that is a quality improvement project. So is the project with Commissioner Glass.
Thank you, Craig. Health Communications Committee. I know Lisa.
Yes, yesterday the public information team, Harold and Kim and I met with a candidate for our internship social media specialist, new hire, Jerica Robinson, who is getting a master's in public health at St. Louis University. Rhonda introduced us to the ambassador program. So she's going to be working with us on a pilot basis, or working with the department on a pilot basis for 4 weeks to look at and increase our social media presence, to build awareness and understanding of the Department of Health. She may be able to make a short introduction presentation at the next meeting. But this was identified as a good step to take by Dr. Mahdi and several others on our committee about 6 weeks ago. So we're happy to say we're following through. And Ms. Robinson has excellent background both in social media and in public health, and is doing some other internship work right now with Mosaic Beginnings.
Wonderful, thank you. Thank you, Lisa.
Okay.
Craig, can I go back to you for 1 minute? You mentioned just some of the QI work, and you will be giving a presentation on accreditation and the QI PI work that the health department is doing. Is there anything that the board should prepare in advance or be aware of to best facilitate that, to participate in that discussion about accreditation and QI PI?
So I'm thinking, and this is just rolling around in my head, is how we get some of this video, these video aspects, and somehow break it down into something that we can upload to Fab. I think there probably is a way to upload videos, but what they really like is something that's more focused. So how we might be able to extract some of these things is what I'm thinking. You guys are doing all the work. Thank you very much. And I know that governing is another piece. It just happens to be this time with performance management and QI, but the governance piece is there. You did part of that in terms of the orientation. And I'm sure that there will be other aspects to this. You've already done your work with your bylaws and the declaration of racism as a public health issue and so forth. So a lot of things are already there. We just need to be conscious and intentional about it.
Thank you. All right. Any department updates, Dr. Eccles?
Along the lines of quality improvement, performance management, that was another area of improvement that was identified where the health department really didn't have a dedicated staff to really lift that work. And so due to, again, advocacy, the health department has been approved to bring on another management level staff that can oversee quality improvement and performance management, as well as monitoring and evaluation for the health department. So we're actually conducting interviews now to fill that position. That's the biggest update we have at this moment.
Wonderful. That is great news. So now, old business. Does anybody have any old business? I actually have a little bit of old business to discuss, but does anybody else have any old business to mention or to bring up? All right, so I will just take a couple of minutes. We had a health equity working group in response to some of the issues around structural and systematic racism and disenfranchisement and all of the things that have historically happened in this region and nationally and globally, I'll say. So Amanda and I have been meeting, Amanda Holmes, and I see her on here. We've been checking in regularly, and we thus far have some students who have been working on looking at the strategic plan as per Dr. Eccles' suggestion to identify places in the strategic plan where health equity and anti-racism and inclusion are already featured, and other parts of the plan where they could be featured. And we are wrapping up that kind of analysis or review of the strategic plan. And Amanda, if you want to, just say a couple words, if you're available, that we have some students working on different identifying information and best practices for issues related to equity as requested by the different departments that Amanda's been working with. So we do have a team of folks that are working and trying to help the health department move forward in being inclusive leaders and an example for the region.
Yes, thank you, Dr. Burley. The conversations have been going really well. So the graduate students will be assisting with getting some research and frameworks together based on suggestions from our racial equity subcommittees related to recruitment and retention, community engagement, as well as education and resources. And so those can kind of be starting points based on action plans that were created through our participation in the Ford through Ferguson Racial Equity Roundtable. So this is the starting point to really transform the department towards being more racially equitable, and then in turn, how we interact with the community. So really excited to be continuing this work.
All right, thank you, Amanda. Any announcements? Any community events? Any good news? Anything that we need to know about, be aware of? All right.
So a couple of things. So with FEMA, so as I mentioned before, we'll be working to canvass and do outreach with staff from FEMA over the upcoming weeks to inform the community about the site that's downtown, but also gain more information about any issues that may be causing them to be hesitant about coming to the event or any barriers that they may be experiencing. Then we're also preparing for summer months. So the health department typically does a lot of outreach during the summer months. And so as we resume our a lot of our HIV prevention efforts, we'll be having staff go out and then to the communities, distribute resources and information, also make them aware of testing and treatment resources that are available in the St. Louis region. One larger event that's coming up will be Pride in Tower Grove Park, which will be in June. During Pride weekend, and so the health department will be there providing resources and information, as well as continuing our outreach efforts, our grassroots level outreach efforts across the region. For that, and then the next thing is we're still working with Christian Hospital Northeast to bring them on as an expanded testing, HIV testing site through the state. Again, this would be really a win for the region, with Christian Hospital Northeast being having the busiest emergency department, according to them, in the state. Bringing them on as giving them resources that they need to implement opt-out HIV testing in their emergency department will be a great win for, again, the region as we look at the HIV and STI rates. And so a lot of our efforts are kind of regional, and so we're just grateful for the partners. We're also, this year, the grant year for the Ryan White Part A grant has started. And so this year we've been able to bring on additional partners such as SSM, another hospital system. We also brought on Affinity Healthcare and AT Steele University as for oral health services. So we're expanding the network to increase the access points for quality services for persons living with HIV in the St. Louis region as well.
All right, thank you, Dr. Eccles. And right on time, it is 9:30. So unless we have other announcements or comments, I am going to adjourn the meeting. And just for future announcements, our next board meeting will be on Thursday, May 20th. And I will follow up with some additional information about that. And our next board retreat will be in the evening. More details to come after the official workday, even though I know many of our board members work well into the evening, but after the 9 to 5 official workday, we will be having our training on May 5th, and I will send more information about that. So thank you, everyone. Mask up, stay safe, be well, and have a good rest of your day. Thank you.